Diana. And first of all, I want to say that Véronique Touvenot, who has founded the We Observatory and the Zero Mother Die project, asked me to come here and talk about the Zero Mother Die project and health and ITC. I want to say that I'm a medical doctor, I'm a public health practitioner, really not expert about ITC, a little bit skeptical sometime in my former practice for the last 30 years about what help it could give the program and try to improve the well-being of people. And this is why I was very pleased to come here, and for the 2 days I learned a lot, and thanks to you all experts in ITC, because I'm slowly understanding how in a practice it can help support some strategy for access to healthcare or empowering women for well-being in remote countries and so on. So it's true that I will go back to France where I'm based with a sort of change in mindset. A lot of people have talked about that yesterday, about that, and well, definitely it happens. And I've been working in the past 30 years in developing countries most of my time, and really working on access to healthcare, access to health, access to the right to health for people, on community-based approach as a key element for success of impact of the health program, participation of people in the design and implementation of the program, and also the bottom-up approach. And I came here with all that in mind, and I'm discovering that, yes, there was some path for collaboration, and I know now that ICT can help to improve the project and the coverage and the, I would say, efficiency of the program. And this is why when Véronique Touvenot asked me to be advising the Zero Mother Die project, I have accepted, I have accepted because I understood the goal of this project, which it's a global partnership which want to contribute to save lives by fighting maternal mortality and focusing on pregnant women in vulnerable situations. They can be living with HIV, they can be living in remote areas where there is no access to services, they can be with other problems, and so this is the target population that Zero Mother Die wants to reach. It intends to provide them with mobile technologies and tools so they can access to healthy pregnancy information messages and call also to their local health worker they can reach through phone. So they are given some mobile phone, the little pink mobile phone, free of charge, it's a free mobile phone with minutes, 3 minutes for months for they have 6 months pregnancy plus 6 months after the delivery. It is free of charge to call their midwife or the health worker, which is not far from them, and ask questions. And they receive some messages, information messages about, first of all, the evolution of the pregnancy. Those the messages are sent according to the evolution of their own pregnancy, and reminding them to look at some warning elements or warning signs, and say if there is something, you have to go to the health center. If not, you can do this or that. And the messages are sent in local languages. That means it's really targeting women where they are living and speaking with the local language they use. So it's really adapted to the different communities. And this partnership has been developed by Millennia with 2 other partners. One is ADA, Advanced Development for Africa, which is an association, I think the headquarters in Mali. And it's a Pan-African organization working to accelerate the scale up of development and achievement of the famous Millennium Development Goals, which we don't call anymore like this, but we'll see what UN has prepared. And so they work on, they combine technology, capacity building, cross-sector partnership, and they try to work with women to improve the health, education, and empowering of women and youth. The second partner is Universal Doctor, which is an e-health tool facilitating communication between patient and nurse or medical doctor. By translation, that means anywhere, if you use this application, you can talk with your medical doctor even though you don't talk the same languages. And so the messages, they contribute to translate the messages which are sent to the pregnant women. So I have to admit it's a very interesting project which will be implemented soon in 4 countries in Africa and documented to see if it can be replicated. And it's very, it has in mind to be close to the people at the community level, speaking their languages and responding to their own needs of information and monitoring and help. So, when I analyze that before giving my answer, I have to say that this project responds to, which is a crucial question around the world, the vulnerability of women around the world. And one colleague in France has tried to list a number of vulnerable situations for women, and definitely Zero Mother Die responds to one of those, which is pregnancy. As you see on the slide, 800 women are dying during the pregnancy or after delivery every day. And in a way, nearly 300,000 women have died because of the problem in pregnancy last year. So the major cause is, of course, bleeding and different signs, but it's also distance from healthcare, not accessing the healthcare services. It's also a problem of being comfortable to go to the health center, being welcome to the health center, and being understood by the health center. And also this project takes into account the different sociocultural elements which prevent women, in many countries I've worked with in the past, definitely have some barriers in the context of social cultural context to go to the healthcare, and they stay in their community, and sometimes a lot of problems happen. So Zero Mother Die is really a question of accessing healthcare services. And I'm not talking about health, because if we talk about health, then we include clean water, we include a lot of practice like tobacco and so on. Let's say just access to health services, which is already one major component. And I read recently the last World Bank report, which was saying that the vulnerable women should be targeted, and that includes the 38 million women who delivered a child in 2013 without a skilled birth attendant, and the 50 million women who didn't have 4 antenatal visits to take care about their pregnancy. So it's really a crucial question, and this program can really make a difference by reaching women in a remote area and really share information regularly, monitor their pregnancy, and help them to make decisions about their own pregnancy and well-being. And when we talk about women, we talked also about adolescents, because when I've been working a lot with the African countries, and when you look at the average age of the first pregnancy, it's really, nearly 13, 14 years old. So we are really talking about girls, young adolescents, and sexual and reproductive health as message to send also. And talking with Véronique and the team, definitely the project wants also to provide access to education information through mobile phone for the pregnancy. Hopefully it can expand to other areas if it is a success. Access to counseling also. It's not enough to give information and say, oh, be aware of this or that. We have to listen to what they say, counsel them. And I strongly believe in a sort of counseling strategy face-to-face. even in Africa or Asia or whatever, and we try to develop that in many organizations. But I think if we can also reach women through mobile phone in remote areas or where they don't dare to go to the healthcare, then we bring a little bit a decrease of distance and we have an objective. Preparing this presentation and discussing with Véronique Touvenot and Doina, I was thinking, yes, I begin to understand why ITC and communication and mobile phone and so mHealth, eHealth can be a plus in many projects. And I try to take two examples. One is Esther. It's a French initiative which Bernard Kouchner asked me to lead in 2002. And it was at a time where people had no access to antiretroviral treatment. And the challenge was to give access to this treatment to people. And the idea was to build twinning between hospitals, I mean clinical team and administrative team, to reinforce, strengthen the local capacity to provide access to quality treatment and monitoring. And so the first target was the reference hospital and center, but the second target with the team, we tried to work on continuity of care. So it's a sort of obsession I have in my practice, is to open the doors of the hospital and give a floor to the association, the group of people living with HIV, the group of women in Burkina Faso or whatever countries we were working with, and try to help them to make a platform between the reference center with healthcare and the community with their needs, with the capacity and the empowering possibility they have. And I was saying to myself, well, the only, and I had at that time an impressed feeling of being very clever, is to use, we had meetings through internet and with different countries, and I had the feeling it was really a thrilled ITC communication. But being here, I said it's really nothing. And so I was saying now, what if ICT would have been accessible when we were putting in place Esther in 17 countries with 70 hospitals twinned, with more team in the different countries in Africa and Southeast Asia. Of course, it would have helped us because the idea was to reinforce the reference center, to open the floor to the association and go to the district hospital, go to the health center and go to the community, which you tried in each country. And definitely it would have helped us to reach more people with of course, information, but also help to make something with the information and go to the center or ask to the local health worker to talk and work with them. Of course, it would have helped us to be sure that there is a people treatment adherence, which was really the challenge at that time. It still is. And it would have helped us to monitor, like Zero Mother Die is doing with the pregnancy. We could have eventually helped them to be adherent to their treatment. And I'm convinced that it would have helped us to work with the health workers and discussing with them, supporting them to make decisions locally, and not referring systematically to the hospital or not referring systematically to the medical doctors, but having a very strong approach to monitor the treatment and give information and help counsel people living with HIV and their families. And of course, mobilizing for special events. It would have probably helped us also to enhance the participation of people and people living with HIV/AIDS and women also. In the decision we had to make to monitor the project and reorientate eventually the project according to the needs we could see and the request, and it would have helped them to participate in the design and the implementation of the project, which is key for the success of such project, I think. Well, I think, but many studies have proved that. And in a way, it would have reinforced the health promotion approach where people have information and do what they want with the information and do according to their context, according to what they can do, according to the possibility they have around them, and negotiate with others if they need more means. And of course, it would have helped us to monitor the project by, we had some data collection, but it was really a pain, really, to get information from the health worker who didn't have time to fill the form we were asking them to fill. I'm not saying that ICT would have solved everything, but it would have helped, I think, and probably an easy monitoring of patient monitoring and project monitoring. And I saw such a project in South Africa with the WHO tool. It was an electronic patient monitoring system which integrated mother health, TB, malaria, and HIV in the same tool. And definitely, it was a dream for me. At that time, I had left Esther. Another example which I thought about was last year I've been asked to go for a midterm evaluation of a project led by French Red Cross with some funds from the Agence Française de Développement. It was on neonatal and maternal health. And it was to reinforce the system and be sure that women have access to good quality neonatal maternal health in 4 countries, in 4 regions of countries. And the region, if you look Niger with Zinder, I don't know if you know Niger, but Zinder is really far from the capital city. If you look Bamako, it's easy in a way. Gorgol is really the south province of Mauritania, very far. You have to drive for hours to go from to Gorgol, and Bata is a region in Chad, which is really remote countries, remote areas too. And so it was a project tackling that, and what if an ITC element would have been added? It was an interesting project because Red Cross first of all, strengthen the center themselves so they can offer quality care, quality delivery, quality postnatal, prenatal care, quality child, newborn care. And also they worked with their volunteers who were going to the communities and the village to work with the groups of women and their husband too, and the young people too, and try to go on informing about the family planning, informing about sexual reproductive health, about delivery, about one inside, and so on. And they were doing a great job. But here again, I think it would have helped them too, to have a good referral strategy, definitely about the quality center. Then probably it would have helped to break the isolation of women. It's one of the things we saw much in this evaluation, and probably allow them to have an informed decision about their health and their attitude. And to reach youth, technology would have been definitely helpful, and I know a lot of young people who are fond of that, but the big challenge is to have patient-friendly tools for the young people especially, and that's difficult. Last, probably also it would have helped us to help Red Cross to have an ongoing training for the health workers in remote areas to respond better. So I will pass that. I think there are a lot of added value, but also the main message I would like to send is that definitely let's work together. That means, yes, ITC will add value, will help going further, better, more in depth with many things, but we have to work together, health professional and ITC expert. If you want to develop, be sure that, for instance, there is a task shifting policy in the country, Medical doctors have a good power in countries and nurses have not. So we have to really help the government